Hello. In today's video, we'll be discussing about some of the MCQs from this topic where the patient would complain to you about hair loss. So today we'll be talking about alopecia and we'll be seeing some of the MCQs from the same topic. So let's begin with the first MCQ. A cystic, boggy, inflammatory swelling over the scalp in a child with a partial or complete alopecia is. The options are folliculitis decalvans, hematoma, chorion, and congenital syphilis. So you can concentrate on the image first. You can see there is a tender, boggy inflammation of the scalp. So this once it happens in a child, you will obviously try to rule out between a carbuncle as well as a fungal infection, which is called as tinea capitis. So in tinea capitis, there is an inflammatory type of tinea capitis which is called as chorion, which is the right answer in this question. So let us see why is chorion going to be the right answer among all the options given below. So in chorion, please try to remember all the important points. First is that the patient would complain of a tender, boggy swelling of the scalp. The second is going to be the patient may complain of easily pluckable hairs. So easily pluckable hairs. And the next complaint is going to be regional lymphadenopathy. Regional lymphadenopathy would be positive. So along with all these things, the most important point among all these findings in chorion is going to be scarring alopecia. So scarring alopecia. So this is going to be a child who would complain to you of easily pluckable hair, and there is going to be hair loss as well. But the worst part is that the patient is going to end up in a scarring type of an alopecia. So the best answer among all the options given was chorion. Now let us see the next question. So the next question says a 23-year-old female patient. She presented with severe diffuse hair fall for the last 1 month. She had a major accident with severe blood loss 5 months back, for which she had to be hospitalized for 1 month. So she is very anxious that all her hair will fall. So what is the most likely diagnosis? The options are alopecia areata, telogen effluvium, Anagen effluvium, and androgenic alopecia. So out of all these options, the first option is alopecia areata, where the patient would be complaining of a patchy hair loss. So you can see that in the question it says there is a diffuse hair fall, not a patchy hair loss. So we can easily rule out alopecia areata from this entire options. The second is telogen effluvium and Anagen effluvium, which we can discuss it later. The last one is androgenic alopecia, where the patient would be complaining rather about thinning of the hairs in androgenic alopecia, which is having two different patterns. One is a male pattern and the other is the female pattern. So the next two options to be ruled out are telogen effluvium and Anagen effluvium. So in Anagen effluvium, what do you find? You usually see Anagen effluvium in cases of radiotherapy or chemotherapy, which is definitely not mentioned in the question. So what is mentioned in the question is that the patient is having a severe blood loss. So let us see what is a case of alopecia where you will be seeing in a patient with anemia. So any patient of anemia, any patient who is undergoing some kind of a stress, any patient who is pregnant. So in all these conditions, including some chronic infections. So in all these conditions, you would be able to see a diffuse hair fall, which is actually called as telogen effluvium. So the right answer to this question would be telogen effluvium, which is seen in cases of anemia where the patient had a history of a major accident and there was a lot of blood loss. Okay, so now let's go to the next question. So the next question says a 35-year-old male presents with bald patches with no scars. Means there is a non-scarring alopecia and there is a bald patch, means there is a patchy hair loss. So these patches are well demarcated, means they are well demarcated with broken hair at the edges. So what is the right answer here? Is it alopecia areata, androgenic alopecia, DLE, or telogen effluvium? So if there is a patchy hair loss as what is said, so the answer becomes simple that it is going to be alopecia areata. So this is one of the image that shows multiple patchy hair loss in this patient. So alopecia areata, as all of you know, this is an autoimmune disease. It is an autoimmune disease. So earlier in this MCQ, the question said there is some areas where there is going to be a broken hair at the edges. So what is this? This is actually called by another sign. The name of the sign is called as caudability sign. Caudability sign. So caudability sign means the hair is going to break when it is necked. Okay, the hair breaks when necked. So this is called as caudability sign, and this sign is also positive in alopecia areata. So in alopecia areata you have various other findings also. The other finding that you find is something like this. This is called as an exclamatory mark sign. Exclamatory mark sign. This is also seen in alopecia areata, where the outer border of the hair is going to be broad, whereas the hair that is nearby the scalp is going to be thin. So this is called as exclamatory mark sign. So exclamatory mark sign, caudability sign, all these things are seen in alopecia areata. So the typical hair pattern as shown in the image, we have just now explained the same, where you can see the hair is broad towards the outer margin, whereas it is thinner towards the area nearby the scalp. So this is called as the exclamatory mark hair, and among all the options you already know that exclamatory mark hair is seen in this autoinflammatory condition, autoimmune condition called as alopecia areata. So now let us see the next one. All among the following causes non-scarring alopecia except. So there are two types of alopecia. The first one is scarring type of alopecia. The other is a non-scarring type of alopecia. So what are the causes? Now the question says all are going to be non-scarring except. So please try to remember that anything that starts with A or T, like androgenic alopecia, alopecia areata, Telogen Effluvium, Androgenic Alopecia, all these things is going to be non-scarring kind of alopecia, and the odd one out here is going to be discoid lupus erythematosus, which is going to be the right answer. Okay, so in discoid lupus erythematosus, DLE, you may be seeing a scarring type of an alopecia, and please try to remember androgenic alopecia, alopecia areata, all these things that starts with a Anagen effluvium, and then all that starts with T, like Trichotillomania, Telogen Effluvium, all these things are going to be showing a non-scarring type of an alopecia. Non-scarring. So this is something that you can remember. So now let's go to the next MCQ. A male patient presents with a patchy hair loss. Again, the same thing happens. What is it? Patchy hair loss. And then this hair loss is not limited to the scalp, but is also going towards the eyebrows as well as the beard area. So he also complains there is a rapid graying of the hair in few areas. So what is the likely diagnosis? So again, patchy hair loss, it's simple. Wherever you see patchy hair loss, it is more likely to be alopecia areata. But what do you mean by this rapid graying of the hair in few areas? So this rapid graying of the hair in few areas, this is actually another phenomenon that you see in alopecia areata. This is called as turning gray phenomenon. This is called as turning gray phenomenon. Patchy hair loss, but this hair loss is not only in the scalp but also affecting the eyebrows as well as the beard. Okay, and this patient is also complaining of the turning gray phenomenon. So this is going to be alopecia areata once again. So let's see the next question. That is, a middle-aged woman comes to your clinic for her 16-year-old daughter and with complaints of hair loss from the temporal side. On examination, it was found that her hair is broken at a different level. So what is the diagnosis? Is it androgenic alopecia? Is it alopecia areata, telogen effluvium, or trichotillomania? So we already discussed about alopecia areata as well as telogen effluvium, because in alopecia areata we discussed that there is going to be a patchy hair loss. Along with that, you will be able to see an exclamatory mark sign. You may be able to see a turning gray phenomenon. Cowdability sign may be positive, but none of these things are mentioned here. So this can be ruled out. Now what is the second thing? Telogen effluvium also was discussed few MCQs earlier, where we discussed that either a surgery, pregnancy, some blood loss, anemia, chronic illness, all these are going to be the causes of telogen effluvium. So this can also be ruled out. Now there is only a hair loss from the temporal side, not from the frontal part. So this indicates that this is going to be some kind of a psychiatric illness. And where, how do you understand? Because the hair is broken at a different level. So what will happen if you try to pull your hair by yourself, and what will happen? This hair will start breaking off at different levels. So this is a condition called as trichotillomania, which is also considered to be a psychiatric illness. This is also considered to be a psychiatric illness, where the patient may try to pull off the hair from the temporal part of the side of the scalp, or they may even try to eat off the hairs. So all these are part of trichotillomania. So let's go to the next MCQ, that is a 28-year-old male patient comes to your clinic with complaints of hair loss. So there is no mention whether it is going to be a patchy hair loss or diffuse hair loss. But while taking the history, you noted that he had a typhoid fever a couple of months ago. So the patient is very concerned about his condition. Now what do you think? A patient who is giving you a history of a typhoid fever, which is going to be a chronic infection type, and is complaining of a diffuse hair loss, or is just complaining of a hair loss, but there is no mention of a patchy hair loss. So what is going to be the likely diagnosis? The likely diagnosis is going to be again telogen effluvium. So in telogen effluvium, what is the best treatment? So is it topical minoxidil? Is it topical steroids? Is it reassurance or hair transplantation? So remember, in telogen effluvium, the best treatment is going to be reassurance, because once the patient is out of the stress, once the patient is out of this infection, this telogen effluvium, this increased shedding of the hairs in the telogen phase is expected. So what happens after 3 months? The patient will come back to normal, and there will no more be any kind of a hair loss. So you can better reassure the patient that these symptoms may bother you up to 3 months, and this is a duration of telogen effluvium usually, okay, because this is a duration of the telogen phase. So now let's see the next one, that is alopecia areata. So alopecia areata is treated by tranquilizers, minoxidil, Whitfield's ointment, or parenteral penicillin. So out of all these options, the best option would be minoxidil, even though for alopecia areata we may use some topical steroids, as it is an autoimmune disease. So along with this topical steroids, you may also use this topical agent, which is called as minoxidil. So going to the last question for the day, that is, all of the following are components of follicular occlusion tetrad except. So there is something called as a follicular occlusion tetrad. Tetrad means there is going to be 4 features. So what is the odd one out? Is it acne conglobata, hidradenitis suppurativa, dissecting cellulitis of the scalp, and folliculitis? So please try to remember acne tetrad, that is acne tetrad or follicular occlusion tetrad. You can remember it with the mnemonic HADP. So what is HADP? H for hidradenitis suppurativa, A is for acne conglobata, D is for dissecting cellulitis of the scalp, and P is for pilonidal sinus. So out of all these options, the odd one out is going to be folliculitis. So that is not included in the follicular occlusion tetrad. So with this, we have completed today's discussion of 10 MCQs from the same topic, that is called as alopecia. Thank you so much.